So tell me a little bit about Karma Clinic. It seems like it's a very radical and interesting and avant-garde approach to dispensing of your services.
So while I was in medical school, I worked at a lot of free clinics, and our school was in a pretty rundown neighborhood. And I realized that most people in either those clinics or the neighborhood that were where our school was didn't really have access to healthcare. And when people mentioned healthcare, they said, "We can't afford going to a doctor." And because the school clinic was there, it was kind of like, well, it only costs $20 to come in. So why don't you come on in and we'll treat you? So it worked for the area that we were in. And I said, well, if these people don't have health care, how many other Americans don't have health care? And it turns out 41 million plus Americans don't have health care, and even more are way underinsured. So there's Americans that have so-called health care but don't realize that their health care doesn't really cover their needs. And then when you talk about naturopathic medicine, it's basically boutique medicine. Most naturopathic doctors don't accept insurance. So even if you have insurance, you have to pay a certain amount of money out of pocket to go see a naturopathic doctor. So when I took all these things into consideration, I said, well, we really need to do something that's different. And then there's the whole business aspect to medicine. So um, our culture has kind of created this field of medicine, in the sense of, if I go see a doctor, then I have to pay a certain amount of money, and we've we've come away from what it used to be, which was being able to go to your doctor, and your doctor doesn't charge you anything, but the doctor is supported by the community. So it was never a concern for the doctor of, well, how am I going to survive, or how am I going to pay my rent, or where's the food going to come from, because it was a communal effort. So people that were getting treated, that were getting better, would take care of their doctor. The doctor would take care of them. It was a pretty win-win relationship. Um, so when when taking all of these things that I was seeing, learning, I basically said, well, how can this be applied to what we're trying to do? And that's when Karma Clinic came about. So Karma Clinic's concept is, we're totally gift economy, which means that we we give our gifts with a lot of love, and people that receive the services do what they wish to do with the gift. So if they wish to give back, great. If they don't, that's fine too. Our main prerogative is to give with love. So we believe that if we give, the universe will take care of us. So that's pretty much the gift economy concept, where it has been applied to different realms. For example, Karma Clinic, Karma Kitchen, um, in the Bay Area actually serves to, one day a week, serves a meal that's totally gift economy. They get a bill that says $0 at the end of their meal, and people give what they wish, and however they wish. And this this idea is great, and it works really well. So we've decided to kind of bring it to the health world and see if it'll work there as well. So we're experimenting with the idea um, of a community-oriented center for health that gives health.